The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today's podcast is going to be talking a little more about the budget reconciliation bill in Congress, as well as the potential for Medicaid cuts. The specifics on this one will be talking about Medicaid outlier states and their overexpansion, which is really stuck in the craw of conservatives. And my belief is that this could drive some budget reconciliation cuts in Congress. So we'll take our normal 3 breaks and break this up into 4 parts here, but let's get right to it. So President Donald Trump and GOP leaders in Congress have seemingly ruled out, or at least backed away from major changes that would impact coverage. And sentiment seems to be turning away from deep Medicaid cuts. The House's large GOP budget reconciliation healthcare spending reduction bogey is being challenged by the Senate, which has drafted a reconciliation framework with reductions that would be much smaller. In the end, the House actually had to pass the Senate's framework, but they are still working on major reductions. Many GOP leaders and conservative think tanks still want to rein in the Medicaid program, so they want to make Medicaid cuts part of the overall budget reconciliation reduction package. Conservatives don't love Medicaid, we know that. Their philosophy is that it is a handout. In their minds, healthcare is a commodity, something you budget for and earn over time as your income climbs. If they were to cover someone's illness, it is largely done behind the scenes, perhaps through Medicaid slush funds to powerful hospitals in big states like Florida and Texas. And it's usually not done through upfront coverage. I clearly think they are wrong. It is far more expensive to cover care in emergency rooms and through inpatient admissions rather than cheaper upfront care. But where conservatives could go beyond instituting work requirements is to focus in on so-called Medicaid outlier states and their overexpansion of the Medicaid program. They will characterize this as waste in the system, and this could be one area where there is a meeting of the minds between moderates and rightists in each GOP-controlled chamber. With that introduction, we'll take our first break, and we'll be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. We hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking more about the budget reconciliation bill that's going through Congress and the prospect of Medicaid cuts. And specifically, we're focusing in today on some initiatives by conservatives in Congress to really focus in on spending on what they believe are Medicaid outlier states and how they've overexpanded Medicaid. So what are outliers and overexpansion? I've sort of used this phrase already. So conservative Republicans hate the idea that progressive states have added significantly to Medicaid costs in 2 different ways. Number 1, these states have added demonstrably to the Medicaid rolls by expanding eligibility beyond mandatory populations or even optional populations most states adopt. Many look to California, New York, and some others in this case. California stands out as the most adventurous on Medicaid, as the Golden State has added undocumented residents to Medicaid. California is being accused of getting around bars on adding undocumented immigrants to the Medicaid rolls and effectively doing so with federal matching dollars. We'll talk about more on this in a little while. These states, too, have added a whole range of discretionary benefits, again, well beyond what most states adopt. Conservatives complain about the dozen or so states that successfully applied for and were approved for major expansions where Medicaid dollars pay for social benefits. This largely occurred during the Biden administration. The Trump administration recently pulled back fast-tracked 1115 waiver guidance on social determinants benefits adopted by the Biden administration. So that's my quick explanation of the outlier states and over an expansion. We'll take our next break and we'll come back to this argument of reasonableness versus excess in the conservatives' discussion on Medicaid outliers and over expansion. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking the budget reconciliation bill, potential Medicaid reductions, and some conservatives' views about Medicaid outlier states, largely the progressive states, and how big their Medicaid program has become. So we told you a little bit about what the concept of outlier states and overexpansion is. It revolves a bit around the number and depth of populations that are covered in these states' programs, as well as the number of benefits, specifically on major expansions in the area of social benefits in Medicaid. So as I alluded to before this second break, it's really in the conservatives' mind all about reasonableness versus excess. So as the budget debate rolls out, the GOP may make the case that, again, it is all about reasonable expansions of populations and benefits versus excessive ones. Adding to all this are accusations by conservative lawmakers and think tanks that states find all sorts of questionable ways to fund their state matches, leverage increased federal dollars, and then expand Medicaid to more and more people and additional services. Conservative groups like the Paragon Health Institute have pointed out that the percentage of Medicaid that is funded by the federal government versus states continues to increase dramatically. And this trend goes beyond the Obamacare enhanced reimbursement for expansion populations. I would note that Paragon holds great sway in the administration and Congress. Many of its staff and fellows have served or are serving Trump 45 and 47. States have several creative ways outside of usual general budgeting to leverage more federal funds for Medicaid. I've talked about these in previous blogs and podcasts. These include quickly the following: provider tax. You can see my recent blog on this topic at the blog site. Intergovernmental revenue transfers, usually from local government taxes, or certification of certain public expenditures at the state and local level. While there are some safeguards built into the federal law and rules, the big complaint is that the revenues or certifications mentioned above are shuttled back to the same providers from which the revenue is derived. Effectively, within the federal rules, providers are promised the revenue back along with additional federal match dollars. In my mind, it creates great bloat and lessens the drive for efficiency in our healthcare system. This is especially the case for hospitals. While the machinations noted above are practiced by almost all states, conservatives complain that they are prolific in states with major coverage and benefit expansions. This has created two different safety net insurance profiles in states. Those with unreasonable and extremely rich coverage and benefits, and those that have programs much closer to federal Medicaid minimums, or at least within reasonable parameters above that. Simply put, conservatives view the progressive states as excessive in terms of their Medicaid reach. Again, I am pro-coverage, but to some degree, I see their point on the progressive states. Medicaid was meant to be a safety net for the poor. I am also concerned about the long-term sustainability of the program. I am supportive of some expansions beyond the original construct because consistent and reasonably comprehensive coverage is important. Medicaid can be a cost-effective way to do that. Indeed, many states do not do enough on Medicaid or coverage and should actually expand populations and benefits. But should there be a new standard that creates reasonably comprehensive coverage and does not reimburse for things beyond that? Anything beyond this comprehensive standard in terms of eligibility and benefits could then be 100% state funded. Could Medicaid reimbursement be reformed to recognize this new reality? Perhaps a well thought out and reasonably generous per capita cap program. With that, we'll take our next break and we'll continue on with our discussion of Medicaid outlier states and their overexpansion of Medicaid, at least in the minds of conservatives looking at making budget cuts. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking Medicaid outlier states and overexpansion, at least in the minds of conservatives in Congress who are looking to make reductions in Medicaid. Where are the likely focuses here? Well, all this is to say that conservatives in Congress, with the support of research from conservative think tanks, likely will focus here for Medicaid cuts during the budget reconciliation process, along with work requirements. To be clear, I have rather negative views on work requirements. Studies would seem to indicate that 90% or so of enrollees either are working or would meet some sort of reasonable exclusion. What's more, the studies point out how expensive implementing the work requirements are. They also tend to strip eligibility away from current or potential recipients due to administrative requirements, not so much because they do not actually meet work requirements or exceptions. But back to waste in the system. While the Senate is aiming for very, very narrow spending reductions, cuts will occur because rightists in the House and to some degree in the Senate want to limit deficits and debt to extend the 2017 tax cuts. Cost cutters are likely to focus broadly on fraud, waste, and abuse and liberally interpret it. In addition to traditional approaches to attacking fraud and abuse, conservative budgeteers could curb provider taxes and other practices states use to generate federal match as part of the so-called abuse bucket. Backing up the drive are two recent studies. The Paragon Health Institute and the Economic Policy Innovation Center recently focused in on California and the various ways the Golden State effectively exploits matching rules and launders money, their term, to fund its state share at the expense of the federal Medicaid budget. Despite this, California is facing billions in shortfall in Medicaid, perhaps backing up the idea that expansions have gone too far. Separately, the Paragon Health Institute issued a very detailed and far-reaching assessment of Medicaid provider taxes, state-directed payments, supplemental payments, and certified public expenditures. While providers, especially hospitals, argue the money-raising tools are long-standing and legitimate, Paragon makes a good case for at least some reform. Paragon calls for Congress to reduce what it sees as money laundering again and abuse by doing the following. First, adopt a 3.5% state harbor threshold for the tax at a minimum as opposed to 6%. Ultimately, it would like bans on the use of provider taxes as a means to fund states' Medicaid costs in toto. And number two, eliminating or capping of state-directed payments and lump sum supplemental payments so that effective Medicaid payment rates do not exceed Medicare rates. You can see my recent blog on this for more reduction scenarios at the blog tab of healthcarelabyrinth.com. So what's the skinny in the conclusion here? Well, some conservative lawmakers would love to tackle growth by more extreme block grant or per capita cap measures that would limit federal growth year to year and over time. Despite my thoughts on a reasonable per capita cap program over time, these measures will be seen as too extreme by many moderate GOP members in each chamber right now. But look to conservatives to appeal to moderates to back provider tax reform. There is an outside chance that moderates could get on board for other proposals that would limit reimbursement to, quote, Medicaid-rich states, the outliers, and the overexpanders, as well as some state reimbursement reform. For example, the reimbursement rate for administrative costs. But I deem those perhaps long shots in the coming budget battle that will roll out over the next weeks and months. So stay tuned. With that, we'll conclude this episode of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.